Thank you, Kathy. It's been a pleasure to work on both committees. It's been some amazing work that's gone on, and it's just been wonderful to have seen the network that actually has been created as those of us who have both worked on each of the committees have connected to other sort of agencies and professions out in the community, and I really do believe that we are going to make an impact this time around. So the report, as you heard, had several actions, and one of them was to inform women and healthcare providers about the weight gain guidelines and to talk about the services that are actually needed for preconceptional counseling and care. And we really wanted to make sure that we had tools to be able to assist women to gain within the guidelines, to allow clinicians to be able to do this a little bit better, but also to have women to have this access to this information correctly. And so I really feel that it was these two action items that led to this dissemination and some of the products that I'm going to show you right now. And it's really an honor to be standing here on behalf of all the hard work from the committee members to show you some of these products. So you've seen the overall poster that we have. One of the themes that we have tried to make with each one of the products is to make it visually appealing, to make it easier to understand, so that women at all different educational levels can actually relate to the information, and to also have it be simplified for prenatal care providers to be able to remember the information. And so you can see that we have two pamphlets. And I'm going to go into details about them. These are the two right here that I'm going to show you a little bit more in detail. And so let me begin with the provider pamphlet. So this is the provider pamphlet. It's a little bit smaller. We made it so that it could fit in somebody's pocket, though the reality is most of our clinicians have the iPhone or some kind of a PDA tool where you can click on it, and so hopefully that they'll be able to download something like this. We also have a little nice card that actually can also be used to be kept somewhere handy. And basically what we're trying to do for the clinician is not to provide all the nitty-gritty pieces of information, okay? It's really to provide the basic information so we get that clear in their minds. Having done focus groups on pregnant women as part of my research projects, I heard over and over again that women did not hear the same recommendations coming to them from their clinicians, and some of them were actually even seeing the same clinicians. And so the reality is here what we have is the information on the different weight status, how much weight is supposed to be gained in the first trimester of weight gain, and then the rates in the second and third trimester. And then also, there's more information given in the booklets, but also giving some information about what happens both before, between, and beyond. And so while we know that some clinicians are going to pick this up and say, well, this doesn't give me a lot of specifics, it's there to make sure that they know the basics. If you want to know more about the specifics as far as some of the science behind it, then we welcome them to go back to the report because that's where that information is. The other thing too that I might add, which is Michael, I thank you so much for advertising for the whole team approach to taking care of pregnant women. There are information out there from the American Dietetic Association and state offices about how to provide counseling and tools to actually help the clinician provide information on asking some basic questions, and I think this was on your prescription pad, Dr. Connery, about some basic questions to ask women that actually can lead to behavior change. Just, for example, how many soft drinks and sweetened beverages are you consuming, and switch over to water. Watching the amount of refined grains that you're actually consuming and trying to consume more whole foods. Some of those basic questions actually really help. And then when more referral is actually needed, to actually use that team approach. And then for the woman, we have a smaller little pamphlet is what we have. And I think we really made an effort to try to ask some questions that a lot of women are asking, and then to provide them with the quick answer for that, okay? We find that women just have some real basic questions and they want to know what the answers are, and so this booklet will do that. But then also you can see in this graphic form, this is pretty basic, you know, telling women that based on what weight you enter pregnancy, this is how much you should gain. And it really sort of, I think, right out in front tells you that the heavier you are, yes, the less amount of weight you're supposed to gain. So that graphic is very simple, in your face, that I think everybody can sort of understand. And there's more questions that are answered in the little booklet for women. And so I think they'll find that useful. Then this is another just overall poster that I think, I believe it's a poster, or right, that could be actually displayed in clinics, that once again sort of portrays that same information in a little bit of a greater detail. Then the other thing that I just love, so this actually came out of another project that was funded particularly for Hispanic women. It's this little weight tracker. If you, I think you might pick it up outside, because I'm not sure they were in the in your pamphlets, your folders. And I really like it because it's both in English and in Spanish, and it's small so that women can actually keep it in their pocket and bring it to their visits. And it provides information about, once again, how much weight they should gain, and then it's one weight gain graph that provides the information for all the different pre-pregnancy weights, and so they can literally just monitor their weight gain. And so I think this actually is a nice tool to be able to use as a conversation piece between the patient and the provider or the nutritionist, so that they can both be tracking what their weight gain is and enter into conversation about maybe some of the behaviors that might be either pushing them out or either above or below what they should be gaining. It's available in Spanish. And also, that same project that was targeting Hispanic women came together and put the 5 common myths. And I can't tell you how many times I preach about myth number 1, how you don't have to eat for 2 during pregnancy. So these myths are just really right on. They're great. It's a really nice little pamphlet. And once again, it's also available in Spanish, given the fact that Hispanics now make the largest minority group, 16% of all Americans. It's very important to have these tools in other languages. And last but not least, the committee got really creative here, and I think this was the most fun project that I've had the opportunity to participate on. We've developed this interactive infographic, and we went to great lengths in talking to a company about what we wanted, but we wanted something that was attractive, that provided some really quick information for women of different BMI status groups. Now, which button do I need to press in order to get us going? Okay. Okay, so I guide you around by telling you? Okay, so basically, it starts by saying, are you having a baby? Well, let's see what we do to get started. So here's your tool to calculate what your BMI should be in. So let's say we put in that she's 5 feet 5 inches, and she weighs 125 pounds. And let's say her due date is, let's say, July 28th. Okay. So easy information and great. So it tells the woman right away, okay, your BMI is 21, you're within the normal weight category, which is perfect. Now let's get some advice, okay? So what is the right amount of weight to gain? And so here's some questions that we've heard women actually ask. Does it matter how fast I gain during pregnancy? And since I'm at a healthy weight, how much should I gain? So let's hear what the answers are to those questions. You can click on the bubble. Oh, we're going to hear the audio. It's also audio. Oh, okay. So there's some audio associated with it as well. Go to the next one. Oh, why is it important? So there's only audio on a few of these, but you can see that the woman can actually see the bubble, click on it, and get an answer to the actual question. And then we've got some audio in here. It might not be working as well as we want it to right now. Here we go.
Can my baby be affected by my weight?
We should have Anne do this. She's the one who's been shepherding this work, which is fabulous.
I think I'm in really good shape, so I don't have to worry too much about how much I gained during my pregnancy, right?
I can tell you this is hot off the press.
Great shape. We still recommend that you gain within the guidelines for your BMI category during your pregnancy, because we know that this is related to the best outcome for the baby now and in the future. It also provides you with the right amount of stored fat to support breastfeeding and less weight to lose after the baby's born.
And so what we really like about this is the fact that it does, a woman can actually go into her appropriate, BMI weight classification, get answers to some questions that are very relevant for her, and it actually, gives you some advice. And let's see if we can, let's go to the obese one, because I think that one's a good one to go to. And so it really talks about some of the concerns that these women have. How can I get to the healthy weight? Can we click on that one?
I gained about 10 pounds more than I planned to during this pregnancy. Do I really need to worry about losing it before I get pregnant again?
That all depends on how heavy you are. If your weight is still normal, having overgained previously is not going to be a problem. If you have become overweight or obese with those extra 10 pounds, then getting back to a normal weight would be better for your own health and that of your next baby.
So this will be out. You'll have the link to it. We are very excited. We wanted to make it attractive. Oh yes, here's that weight gain chart too, so that it'll plot that, and it'll sort of show where the woman is gaining, I think. So that will work as well. So once again, this is new ground for the IOM. I think this is the first time they've ever produced this type of infographic. We felt that this was exactly what the lay public needed for women to be able to have something that they could, it would be attractive to them, they could play around with it and get some quick answers to questions. And in fact, this would be something that I would encourage others in the room to actually think of developing some of these apps so that they can have this kind of information that might actually then go into detail about how much diet and physical activity that the woman then might actually need to have during the pregnancy. So we're delighted to have these tools. We would hope that you would use them. Encourage the people that you work with to get copies of them, and also to let us know how we can improve. Lots of us are actually working in many different avenues in providing some more of this material. I'm actually working with ACOG right now, and there's going to be a monograph that will be published in the next few months on women's nutrition throughout the life cycle. And so I'm really excited about having written that piece, and there's a pregnancy and a postpartum piece associated with it. So we're open to any questions, but more than anything else, we hope that you would take and run with these tools that we've developed, which I think are attractive to this era of women who are becoming pregnant. Thank you.
We have about 5 minutes for questions. Why don't you have a seat, Anna Maria? So if you've seen the tools and you'd like to ask us about them, now's the time.